Dermographism is an exaggerated wheeling tendency when pressure is applied on the skin. It is also called dermatographism, dermatographia, and dermatographic urticaria. It is an allergic reaction affecting the mast cells found below the surface of the skin. In 25 to 50% of normal people, firm stroking of the skin produces first a white line, then a red line, then slight swelling down the line of the stroke, and a mild red flare in the surrounding skin. In 5% of the population, this response is exaggerated enough to be called dermographism. In only a minority of these does it cause any symptoms. The diagnosis is made by stroking the skin with an object, such as a pen. The appearance of a red, itchy, and sometimes raised rash along the area of the pen stroke makes the diagnosis. When people who have dermographia lightly scratch their skin, the scratches redden into a raised wheal similar to hives. These marks usually disappear within 30 minutes. There are no apparent risks to this diagnosis. Mast cells are located right below the surface of the skin and mediate allergic reactions. They store a number of different chemical mediators, including histamine and various other enzymes. The exact cause of dermographism is unknown. Histamine is released when an allergen causes pressure upon mast cells and causes the skin to inflate. Once histamine is released from the granules in the mast cell, it can trigger a variety of reactions. For a majority of people with dermographism, histamine is the main chemical released by mast cells when the skin is stroked, but other chemical mediators may also be involved, depending on the condition of the patient. Occasionally, dermographism is triggered by an infection, emotional distress, or medication such as penicillin. Dermographism can appear at any age, but is most common in young adults. The onset is usually gradual, but in some, the condition develops over a few days. People with dermographism are usually otherwise healthy. Occasionally, patients may have thyroid disease. Many doctors have noted there is an important nervous factor. Attacks of itching and subsequent wheals from scratching occur at intervals and may be related to agitation and worrying situations. Symptoms are often worse in hot conditions, for example, after a warm day outside. Minor pressure from clothing, chair seats, working with various tools, clapping the hands, may start up the wheals. Wheals may develop after exercise if it is accompanied by knocks or pressure on the skin, such as in rugby, wrestling, or boxing. Toweling after bathing may start wheal production. Dermographism can occur with other types of urticaria, including those due to cold or pressure. Dermographism may last for months or go on indefinitely. In many patients, however, it clears within a year or two, or at least the whealing is reduced to a degree which no longer causes significant symptoms. If a person is not particularly bothered by dermographism, then no treatment is needed. Symptoms can be decreased with the use of various antihistamines. Many of the antihistamines that cause sedation, including hydroxyzine, seem to work especially well. If it's not painful, it can be a pretty cool thing to have.